Hello, everybody. Jeff Cantor, Comprehensive Med Psych Systems, group based out of Sarasota, Florida. I get a great chance to talk with you all today, and this is going to be a lot of fun. I actually get to show you pictures of my child, and as it grew through different developmental stages to adulthood. So this is going to be a lot of fun for me. I have actually very little to say today, other than talk a little bit about. I only have 4 slides, which is unheard of. If anybody knows me, you know that for me to do a talk in 10 minutes would be about impossible. But I've got 2 slides on our group, and I've got 2 slides on my dream, my vision, what is the potential out there to help all psychologists in the country get on board with a business model that will help everybody be able to access different types of systems and processes that you just, as an individual or a small group, that people just don't have the capacity or the financial resources to be able to do. So first, let me talk a little bit about our group. We started off in 1998 with 4 psychologists in a hospital, doing in an acute care hospital. It went so well, the hospital liked us so much, we kept getting so many more referrals for inpatients on a cardiac open heart surgery unit, on a rehab unit, all throughout the hospital, cancer unit, diabetes unit, et cetera. We just grew. And eventually, over time, we grew out of the hospital, moved across the street, and basically, over time, got to the point where we had over 50 staff members, including psychiatrists, including psychologists, including social workers, in a variety of different venues. Mostly outpatient offices, also universities. We started a university counseling program where there was none. Public schools we've done projects in. We work in rehab hospitals. We work in the IMG Sports Academy, if anybody knows that. We work in so many different venues. Last year when I was here, I talked about vertical and horizontal integration, with a vertical integration being multidisciplinary, the horizontal integration being in multiple contexts and multiple venues. So basically at this time, actually at the end of 2015, we grew to the point of 107 multidisciplinary clinicians, all these different environments, and we actually doubled our business in the last year. We embarked in the last year on an acquisition phase in terms of buying different practices, improving them, increasing them, adding different services to them, to the point that we're adding in psychotherapy, neuropsychological evaluation, psychological testing, psychiatric medication management, transcranial magnetic stimulation, which you should all know about for treatment of depression, which I can talk about more later on, neurofeedback, biofeedback, et cetera. So the group has gotten very large, and in the process of getting large, it has opened up some areas of access to us, working with insurance companies, working with lots of other different players in the field that we would never have had with a small group or solo practice. And in the process of doing this, all of a sudden, at some point along the line, I realized this had become a major business. And somewhere around the time of when we had about 10 psychologists or so, 10 to 15 folks, and I started looking at this and I said, oh my God, I could probably make more money as an individual practitioner just doing my own private practice than I'm making out of this group. Where is this going? And I really realized that this has really become a business. I need to have a business model behind it. Luckily I had my father, who is a financial guru, give me some of the vision of how to create a business, how to interact with banks, how to deal with loans, how to deal with accounts receivable, how to deal with all the financial aspects that really go from a mom and pop practice to a business of psychology. And I realized that this piece is missing for most folks. This is not what you get trained in graduate school. This is missing. How do you do this? And how do you take it to the next level of 20 folks? How do you then hire in MDs into your practice? The concept of a psychologist employing 20 some odd psychiatrists. I mean, what does this mean for the field of psychology to be able to say that? What does it mean to have a team of folks that are practicing together as a group? Psychologists, psychiatrists, social workers. How does that affect outcomes? How does it affect working with insurance companies? It became a very different business model, a very different clinical model than I had ever seen. And I think at this stage we're pretty unique. There's other folks that do have large groups that are doing some similar things. Dr. Vince Belwar and I are actually going to be talking some more about this tomorrow. He's developed a huge group in Springfield, in Springfield, Pennsylvania. So it's done, but it's pretty unique, and in the way that we're doing it, I think, has opened up some doors and opened up some opportunities that has allowed us to continue to grow and develop some very innovative projects. All of this, as part of the business, requires a very sophisticated back office structure. We have to know about HIPAA. I have to have an EHR that works for over 100 clinicians. I have to be PQRS compliant. I have to have all kinds of different systems in place to make sure that this business moves forward. And it hasn't always been easy, and it has been painful at times, as the table from Indiana can attest to. So part of this has been a learning process for me as to how to build something that really hasn't existed before. And in the process of doing this, the cool thing about it is that it's allowed me to figure out, here's a solution. If I could offer this to other people all around the country, what would it mean if everybody had access to the same types of infrastructure that we have that allowed us to become a successful business? So this is what I want to talk about for the next couple of minutes. This is a preview because it doesn't exist. And you will notice there is some disturbing content in here. None of it's R-rated. I apologize for the R. That's the only one I could find on short notice. But it's very exciting, and to me it's very thrilling to be able to talk a little bit about this, because it came out of the development of our group. And one day, a year ago, actually at a think tank that Shirley had put together and Alan had put together and Catherine sanctioned, we came up with an idea of, geez, how do we take everything that it's taken me to develop and solutions to solve, problems to solve with solutions, how do I take that and then open the door and the floodgates and allow it to get out there to everybody else to access without you having to be my employee? That was the critical piece, because not everybody in this room wants to be my employee, and I don't blame you. But as years ago, I actually brought this up in the state of Florida. I created a list, a communication listserv to talk to people about how do we get people to coordinate to have better outcomes, to have better communication with psychologists. And I found that it was very, very difficult to come up with a structure that, that would allow a business entity that would allow this to all happen. It really didn't go anywhere. I spent about $2,000 or $3,000 in legal costs, and basically they came back, the lawyers came back and said to me, well, they need to be employees of your group. That'll solve your problem. And I said, most people don't want to be employees of my group, so how do we do this? So fast forward now 10 years later to a think tank when we come up with the idea that, hey, if I can figure out a structure to take what I've learned, to take what we've put together and offer it to everybody out there, what would this mean? How would we do this? What's the process? So that's what the preview is. It doesn't exist. This is not long-term future. This is hopefully in the next 12 months, maybe even 8 months, that this thing should be up and running. And this is called a management services organization. It's not my group. It's a separate entity. It's a separate business structure that takes all the pieces of what I've done, puts it into a menu format, and allows everybody here, every practicing clinician, everybody who's in a fee-for-service model, every individual, small group, et cetera, to access the pieces that they want to create for themselves a successful business model that will underlie their successful clinical service provision model. So what if, I mean, you guys all know, I mean, if you're on your state listservs, you know, how many questions a day do you see? What's the best EHR? You know, how do I get a good billing system? Does anybody know somebody that does this kind of billing, and my collections aren't very good? And is Skype HIPAA compliant? And how do I do telehealth? Is that available now? So I see that on our state listserv every day. I just kind of chalk it up as another question, as another question, as another question. Most of those questions we've solved for ourselves. It's just that they haven't been available as an entity to everybody out there. So what if you were a member of a group which offered a sophisticated EHR, something much more sophisticated than Office Ally, something that would give you a graphical format of how your patients are making progress, something that would do a comparison against other normative groups of other psychologists in other parts of the country in terms of your utilization, how many times you saw patients, the frequency that you saw patients, by diagnosis, et cetera, et cetera. A HIPAA compliance plan. Everybody knows about HIPAA. What you don't know about HIPAA could crush you. What if you had somebody that has already been through and has developed a very sophisticated HIPAA compliance plan and that you could tap onto that? What if PQRS was part of the system in conjunction with the APAPO PQRS Pro system? Credit card systems. Everybody takes credit cards. People don't take credit cards. If you actually look at your credit cards and you take the amount that you pay in fees relative to the amount that you bill, invariably it will be over 3%, probably 3.5%. They will tell you they have a 2.5% plan for you. Have you ever looked at that credit card bill? It's got platinum this, that. They charge you, and you have no idea how they charge you, and it'll be different every month. What if you had a system in place that you could access a volume-based discount credit card plan that got you 2% and saved you 40% of your fees in credit cards? What if you had an encrypted email system that you could go to? What if you had clinical outcome measurements? Part of this is what's called a group purchasing organization. Because of volume, what if you could get a discount on your testing supplies through PAR, who's already on board with this and has offered a 10% discount? What if you could get discount office supplies when you move to a new office and you need computers, you need monitors, you need furniture, you need chairs? What if you could get that as part of this group? The idea is that the volume of different, the infrastructure, the EHR, the VIP phone system, the volume of that going through this drives discounts to everybody and allows you to have access to pieces that you would never otherwise have access to. The bottom line here, I don't know exactly how to say this, more effective participation in innovative payer relationships. What if you're part of a member, not an employee? What if you're a member of a group that has access to influence and be part of insurance processes and systems, et cetera? It's a new dance. It's no longer a war dance, but it becomes a tango with you and the insurance industry, because they want the size and scope. They come to me saying, we want to do innovative programs with you, value-based contracting, pay for performance deals that we haven't done anymore. They want to do pilot projects because the insurance companies, they want more efficiencies. They want you to get patients better faster. They want you to have your patients spend less money on medications. We can do that. We can show we have data-driven plans. If you can tap into that and I can say, oh, geez, our entity has 5 psychologists in Nebraska, has 15 psychologists in Colorado, has 75 psychologists in California, we can take all that data, put it together, then all of a sudden we're talking about a national stage dealing with these payer insurance relationships. Changes everything. It's a new dance. The concept is, in 3 boxes or less, is what if there was an entity out there that everybody could tap into, a menu of services of 25 or 30 different types of discounts, EHR systems, VIP phone systems, credit card systems. What if there's 25 or 30 of those? And you could say, hey, in my practice, I do this pretty well. I need number 2, 5, and 7. I want number 3, 4, 7, 9, and 10. And become a member of a group. Not exactly a Sam's Club, but the concept is a menu-driven item list that you can pick what you want to make your practice better, more efficient, take care of the infrastructure, take care of the back office stuff so that you could run your business, you could run your clinical psychology practice much more efficiently, better, and have it be much more lucrative. What if we had that entity? What if you belonged to or are part of a group whose sole purpose was to assist you with non-clinical business functions so that you could concentrate on the clinical aspects of your practice and so increase the efficiency, value, and profitability of your business? What if I took what we've learned through the growth of our group and handed it off to you and say, take my knowledge, take what we've done, and use that, take that piece. You don't have to recreate it. You don't have to go on a list and say, what's the best EHR system? Hey, this group over here, we have an EHR that's been refined, developed for psychologists that works, that you can take even pieces of that you want. Don't pay for this piece over here. And it's no longer asking a question as to where is it. It's you get the advice, you get the knowledge, and you get the actual product with discounted rates, with better relationships with the insurance companies that helps improve your practice, better outcomes at lower cost and more money. I mean, who would not do that? That's the concept. And this is coming. It's coming soon. This is not 10 years in the future. This is in the process of being developed with the assistance of APAPO, with resources from APAPO, because this is a way to take all the individual practitioners and, in effect, create a mega group, but maintaining your independence and autonomy. Make sense? That's it. Sorry.